Apple in hospitals, and audiobook library funding programs fading. This is MacVoices. MacVoices is supported by MacPaw, the makers of Clean My Mac, your ultimate solution for Mac control and care. Try Clean My Mac for 7 days free, then use the code MacVoices20 for 20% off at cleanmy.com/MacVoices. That's CLNMY.com/MacVoices. This one is how one hospital is reinventing care with Apple tech. Now, I know this is just a feel-good story and all that, but I do think it's nice to see that somebody is bucking the Me Too trend and maybe taking advantage of some of what Apple can offer. So take a look at this. This is at Emory Hillendale Hospital in Lithonia, Georgia. You'll see Apple's influence wherever you go, because of iMacs and minis, iPads replacing charts. Every physician has an Apple Watch. Again, it's a little bit of a puff piece, but somebody's doing it and somebody's making it work. And I would love to see just how many, a little more quantification, a little more information on how many hospitals are trying to do some of these things, even if it is just, the Apple Watch and the iPads, because there have been little pieces about it before, but it's something that seems to get overlooked a lot. So, Marty?
Yeah, my wife spent many years working in a hospital, and I had to ask her, so how many employees would a 130-bed hospital be? And she said, well, the one she worked in was 150 and they had like 4,000 employees. I said, what percentage of those would have been direct care service? And she said, in a hospital, probably about 80%. So if we're extrapolating, if they're accurate, we're extrapolating those numbers, this is a pretty big investment on the hospital's source to be able to do it. And I rattled off some of the information from the article, like Epic, not the games place, but Epic does the software. And she was familiar with that. And the notification in the article said Epic offered another platform, offered the Apple platform starting in March 2024, which opened it up with a lot of interest from physicians and healthcare workers wanting to use Apple devices. So I thought it was pretty interesting, and trying to figure out how much it is being. The question I have, Dave might have a better answer to this from an enterprise standpoint. They taking those phones home. I mean, the potential for them having patient data on them. I just wonder if they have to hang everything up before they leave.
I don't think so. They wouldn't take those phones with them, because even any hospital I've been at, I mean, I see the phones that they have older phones, but that those don't leave the hospital. They may forget them, but I don't think there's any data on it that isn't restricted to what can be on there, especially iPads, because they're using iPads for charts, and, you see them coming in, showing your charts and showing x-rays and that kind of stuff. That I almost guarantee it's secure of some way or some point. I wouldn't be at all surprised they're using something like Jamf to manage it, to keep the devices secure, because I remember going to the Jamf conference and many healthcare folks were there, and very, very strong in keeping those devices safe, because you don't want people installing stuff. I mean, I'm working with iPads now that you're keeping it really locked down, because you just don't want people to mess around with the systems, because it's more of a support nightmare really on that end of it as well. But even so, there is data that's out there for any companies that have data that's it's proprietary. You don't want it to get out there, and you got to keep it to yourself. Then that's the only real way you're going to be able to lock it down.
Dave, would you have information on the iPads, or would these be potentially logging into this Epic system? Again, we're not talking about Epic Games.
No, I don't.
This Epic system, so that they're acting more as maybe a secure terminal in for the information.
a lot of hospitals use Epic. Like my hospital locally here, I know uses it because the time I've been there, I could even my doctor. My doctor kind of is indirectly associated with the local hospital here, but they have access to look at that. But I would think it's more of a terminal type of thing, but it's a Windows-based system, though, from what I've seen with Epic in the hospitals I've been to. But yeah, I would think it's some way of terminal into them somehow, some way. I can't say it for sure because I don't work with them in that case, but in that sense. But I would hope so. With all the HIPAA regulations, you have to keep these things very secure, and I don't think people can just go in there willy-nilly, and the device has to be locked down in order to protect that.
Yeah, because I'm thinking, I know my doctor is associated with the hospital group, and I mean, all the communication is done through their portal, and they have a pretty fair amount of security. You know, you have to do the double login thing, and you have to, sacrifice a chicken and all that to get in and get your test results or leave a message for the doctor. So, and I say that in jest because that's the kind of data that really should be kept very confidential and very private.
Oh, 100%.
If you decide to release something, that's your business, but they shouldn't be doing it for you.
Right.
Web?
I was just, as you all know, especially those of you that know me well, I had major surgery a year ago in February. And the hospital I went to does use the Epic system. I can't say that I saw any iPads or anything in every room. At least at the wing that I was in, it had a terminal or a computer. It had a Windows computer in the room, and it had a card reader, and everybody had their ID card to log in. It was all VPN, all very, very, very secure. I think this is an interesting system. I'm glad, but I think it's nothing more than it's a quasi. They're using your iPhone as your iPad. It's just a device to attach to the network to get to it. I don't think it's a massive initiative that Epic's doing. I think it's just a terminal based. Like David said, it's originally a Windows based system. So glad they're doing it. It doesn't hurt a thing. And some of the support issues that Dave knows better than anyone here on the panel about trying to get a Mac or an Apple device to work properly as opposed to a Windows device. We all know those horror stories. But as far as the Epic system itself and my exposure to it on the patient side, I'm very pleased with it. Hell, I'm having another different doctor's appointment tomorrow, and one of the things they're going to ask is what's my medication list. So I went out to the Epic system, downloaded my prescription, my list of prescriptions that I take. So anyway, it's nice. I don't think this is just that big innovative thing, other than people are using their iPads and their iPhones to get to it. So.
I know what you're saying, Webb, and I don't expect it to, this is not like a bellwether where, oh my God, everything's going to get, so much better because Apple's getting into healthcare. At the same time, how many times have we said, the industries we'd like to see Apple get involved in because of their sense, it seems, of user friendliness and organization and reliability and security. So, Dave, you have more?
Yeah, I'm just trying to see if the article mentions that the Emory also has iPads for patients when you're there too. So it does equip every patient with an iPad at bedside, so you can access your medical records, your care plans, order meals, and communicate through the My Chart. My local hospital uses My Chart. My Chart is a way for a patient to be able to go in there and do that. And I've seen some reports too. I think it was UC San Diego, I think, was doing something similar to this. But you have other even the Mayo Clinic is using it for inpatient units to facilitate communications between the patients and their families. So there's a number of hospital systems that are using it. And that was I can go on with others, but I'm seeing this more and more that they're using iPads as a way to do a better job of being able to take a look at things instead of waiting for paperwork to come with a file because that's what they like to do, print because of HIPAA. With fax machines are still used in healthcare still, and printing all your discharge papers is all printed. I mean, that's not secure because that paper could be left anywhere. Just like I would go in and they would give me a list of all the medications I'm on. I'm like, well, can you shred this? Because I don't want this, being going out. Because they give you the piece of paper and say, here, when you go over talk to your doctor, this is the way you can review make sure that you're on the meds we have as a record are correct or not. I don't want to have to. So that means I got to put that piece of paper in my pocket and make sure I destroy it so it doesn't get out there. So why not use these iPads? Because you can keep it so simply secure. But again, these hospitals don't have a lot of budget either. A lot of times, creating a budget for that is tough. And this day and age, you're seeing all these hospitals, even locally here, they're buying up all the different hospital systems and putting them in all. Like Endeavor Health is a big one out here. They've bought up a bunch of hospital systems, so I think iPads are going to be a wave of the future when it comes to this.
Yeah.
It could
Brian,
be that like iPads aren't really more expensive than whatever hospitals are already using. It's kind of hard to tell from this article. It sounds like this Epic Systems, has. I mean, it's just talking about this one hospital, but I think they've developed new software, and this one hospital is just using it, maybe more fully, but it sounds like this is really an initiative on the part of Epic Systems rather than that particular hospital. And it does sound like maybe there's some new stuff because they're talking about, well, use your phone to scan the patient's wristband kind of a thing, like maybe if you go down to get an x-ray, they can just scan your wristband and automatically get, access to all your information. So,
but they do that now. The hospital I went to, they do that now. It just wasn't using an iPhone to do it.
They didn't do it when I was in the hospital a couple of years ago. So,
yeah. Well, here's my band. So,
well, I had a band, but
and it had a QR code on it. So,
Brian, do you want to explain the comment you put in our chat?
Oh yeah, definitely just in jest, but it was during the conversation piece when we were talking about secure data and data not leaving, making sure it doesn't fall into the wrong hands. So maybe they keep all that on the severed floor because severance, and once they go through the elevator, then it doesn't come with them.
I'm glad you explained it because I had missed it completely when you put it in our Slack. It's like, what is he talking about?
It sounded better up here.
Okay. Yeah. Eric, I'll give you the last word on this.
Yeah, at least it wasn't the shark episode. That would have been bad. Once you start using a device to connect to a remote session, whether it's a remote virtual machine or Microsoft Remote Desktop connecting to something, then it really doesn't matter what the machine is. So we're seeing a relatively higher interest and uptick in macOS devices because they're all consistent. They're easy to wipe and rebuild, and it works the same way for all of the different devices. They're fast. The battery life is pretty good. So it doesn't really surprise me that they're doing more experimenting. But definitely it was like iPads in the schoolroom, iPads for patients. That seemed to happen first. But I have to say that the software, the MyChart software for individuals to look at their own records, that has gotten significantly better as well.
Okay. All right, I lied. Web, you get the last comment.
Just real quick. I maybe one of the things that I'm really pleased with since Apple switched over to the M chips is, and you kind of touched on this a little bit, Eric, is the power consumption and the how long the batteries last on these portable devices I think is way hours ahead of our Windows brothers and sisters. And I think that's one of the reasons why they're getting the demand to use those. Not the only reason, don't get me wrong, but I think that's one reason that the battery the battery life on these portable devices on the Apple side, I think, is better than it is on the other side. So,
and that's not a small consideration, Webb, given that these devices have to be mobile. They have to be, no matter which one you're talking about.
oh yeah,
Sure, they're going to be iMacs and Mac Minis and all sitting on desks, but the staff is always going to be carrying around iPads, iPhones, whatever else they need to take and get the information or whatever else connects to them to where the patient is. Anyway, I'm happy to see it. I mean, even if it's a testing ground, which it looks like at the end of the article, there's an indication that might be the case, but I hope that it works out as well as we all would like to think it would.
and don't you feel better when you're getting a text message from your doctor and you're getting a blue bubble and not a green one?
Absolutely. 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 And when my doctor tells me that I should be wearing an Apple Watch, it's just one more of his recommendations I can take that I don't have to be inconvenienced to take, like some of that other pesky stuff that he wants me to do. We won't get into that. But Webb looks like he knows what I'm talking about.
Boy, and how. So
Today's Mac Voices is supported by Clean My Mac, your ultimate solution for Mac control and care. Try Clean My Mac for 7 days free. Then use the code MacVoices20 for 20% off at cleanmy.com/MacVoices. When something goes wrong with your computer at work, you call the IT department and ask for help, right? But at home, Clean My Mac is your personal IT department. The all-new Clean My Mac from MacPaw is more than just a cleanup tool. It's your command center for control, care, and optimization. Notarized by Apple and trusted since 2008, Clean My Mac has evolved from a simple cleaner to a full-featured Mac wellness solution. Its new Smart Care dashboard gives you total control over how your Mac performs, right now. From system cache to development junk, even that growing downloads folder, Clean My Mac makes clutter cleanup fast and satisfying. Worried about malware? Yeah, you should be. Macs get viruses too. Clean My Mac's Moonlock anti-malware engine scans and removes threats in just one click. And with the Assistant and Menu app, you don't even have to open the main app to get tips, fix battery drains, or stop overheating before it slows you down. Named one of the 25 amazing apps for 2025 by the Mac App Store, Clean My Mac is the ultimate way to keep your digital space safe, clean, and running like new. Try Clean My Mac free for 7 days and use the code MacVoices20 to get 20% off at cleanmy.com/MacVoices. That's CLNMY.com/MacVoices. Thanks to Clean My Mac for supporting Mac Voices. So here we go. My usual disclaimer that we don't talk politics here on the show, but we do talk about when politics crosses over into technology. And I was not aware of exactly this, but U.S. libraries cut ebook and audio lending programs following Trump's executive order, freezing library funding. And the article goes on to explain how the whole ebook thing and audiobook lending program works. And it looks like, according to this, it's been largely funded by grants from the U.S. government. And now, as a result, you may not have that option the way you have up to this point. So this is one of those where, the executive order is what it is, but this is how it might affect you. And of something that I know a little while back, I had recommended the book. I think it's called Careless People, about Facebook. And I don't know how many. In fact, at least one panel member had sent me something and said, "Yeah, I'm on the wait list for the ebook or the audiobook for my local library." So I don't know what this will do to that. How do you guys use these services from your local libraries?
Yeah, Libby works really well.
Yeah, I've used Libby quite a bit, and I know, Brian, I know you just raised your hand that you do. Marty? Yeah.
And not just me, but still talking to a lot of mugs. There's and mugs are older generational group of folks. Generally, they love these services. And yeah, so I can't swear on the show, so I'll stop at that point.
Yeah, I'm sorry to see this. I was a little surprised that the federal government had been propping this kind of program up that much. And I just wonder now if maybe there'll be a lot more selectivity about libraries as to what they get. Do they get ebooks? Do they get audiobooks? Are they going to limit them to the more popular ones so that it makes economic sense that they're getting things that people really want? Because it seemed to be quite a bit different than just buying a hard copy of a book and then lending it out. A lot more expensive. So, and how many digital copies could you lend out at a time? Now, I guess honestly, I never really gave any thought to the logistics of the program or a program like that. But after the article explains it, it's like, oh yeah, okay, I can see how that would run into money. And we want to make sure that the authors get paid an appropriate amount. And so that also has to be factored in.
Well, it is a public library. Do they get paid by somebody checking out a book at the library?
Somebody had to pay for the copy of the book, Dave.
Yeah, the government or the library or whatever their budget was, I would assume they paid for it, right?
Yeah, but that's only one book that could get lent out because obviously it's a physical thing. So if you take it, I can't check it out. Web can't check it out.
You put it on a hold, and you put it on wait list.
Yeah. But here, one electronic copy, if you will, could be distributed through that system. It's checked out,
right,
electronically.
There's limited copies digitally as well.
Yeah. So, and I would assume that that's why the price is so high per book, because you're checking out multiple copies.
Right.
So.
You have a whole population, though, that is going to be using this that doesn't have ready access to mobility, going to libraries, getting things. They can do this electronically. And once this program is reduced or eliminated, they don't have access to that. And, they pay a heavy lease on the books that they apparently, according to the article, they pay a heavy lease on the books the electronic books that they lease out or that they share out, and they have to renew that after so many leases. But it allows them multiple copies, and how many books wind up either not coming back or getting destroyed, and they have to buy extra copies of the book anyway. So I just have problems with these decisions.
Well, and the other thing is that there are people that have no other way to finish reading a book because they're commuting, and you're not supposed to read a book while you're commuting and driving. So, it's a way that if you've got a 45-minute drive, an hour and a half drive to get to work, you can check out a book and listen to it on the way into work, listen to it on the way back, learn something, and get through a book. There are a lot of people, if this isn't available, they're just simply not going to read. And it works well. The other way that this gets adjusted is instead of having 7 days or 2 weeks to read your audiobook, you get 3 days, which may not actually be enough time to finish it, and then you go back in the queue. So having enough copies makes a huge difference, especially since there'll be books mentioned on social media, and then there'll be a high demand. It's already 2 or 3 months before you can get one of the books. This just means that it just isn't going to happen. So I think it was a bad decision.
Eric, I don't have a commute anymore, but I still do a fair amount of driving. And yeah, it's a great way to read things that I would never have the opportunity to read. No matter how badly I wanted to, it's just there are only so many hours in a day. And so by having it played to me, and of course, as I've said a million times here on the show, I'm a big fan of, the higher speed listening, so I can get through it faster. So it's one more reason that to develop that skill.
Yeah,
Brian?
don't forget there's a whole lot of kids that they were taught to use audiobooks as a way to access books versus actually doing reading. So turning this off just means that that whole generation then just will miss out access to all that material.
Brian, hang on just a second, because Eric, can you elaborate a little on that? I mean, are you talking about that from a practical standpoint, or was that like something that was taught?
That it seemed to be one of the changes. Brian would probably know more than I do. But for a while, it was, consume a book through an audiobook, and it was a way to get a higher uptake in books being read and consumed. And eventually, there'd be some reading and some audiobooks, but I know a whole pile of kids that's how they consumed all their books. It was all audiobooks.
Okay.
Yeah.
Brian?
Yeah, I concur with what Eric was saying. A lot of our students, when they read, a lot of it will come through the medium of using audio. Even when whether it's the younger kids in class with the like a read along type thing, with you hear like the intonation and the way the speech patterns are and things of that nature, learning vocabulary. And then, more on the independent side of reading as well. Definitely a lot more audio, whether it's books or articles or various pieces of content. A lot of the students enjoy hearing it too, in addition to seeing something. Yeah.
This I realize we're a little bit down the road here, but I'm fascinated by this because obviously this was not something that was available when I came along. So are we talking about in classroom sessions or principally outside, or both?
Definitely both. Yeah, it's something I think, depending on the reading level of whether it's the book itself or the acquisition of learning the language. At different points, it could be very much a whole class activity to hear something. To hear the chapters of a book. It might be maybe reading a chapter independently, and then the next chapter would be done as a audio read aloud. And I mentioned books, but we're looking at articles too. Articles, things of that nature, as well as the books.
Brittany Smith couldn't be with us tonight. She is in the chat room, though. She asks a good question. Are the existing books still available, and it doesn't just apply to new ones? I love Libby and Hoopla. And Rich said I worked in digital services and taught ebook apps. So, Britt, as far as I know, it looks like this is almost, if I read the article and understood it correctly, it's almost like a subscription service that the library or the government, whatever, pays for, and then the library has either so many copies or so many lens for that, and then it has to be re-upped. So I don't have a good answer for you on that one. So I think stay tuned, and we'll see what the effect of all of this is.
Chuck, I think Marty described it very well, that it's a lease model for the digital books. Marty, I think you said that.
Yeah. Yeah, it looks like these services are provided by the library at local library status. The government sends funding to the states, and then the states distribute the funding to the libraries to support what is generally a service that's too expensive for them to get on their own. And the libraries that I think are going to be hit the worst are rural libraries, small libraries. Larger metropolitan libraries will be able to maybe adjust, but the smaller libraries that depend highly on the subsidized piece from federal government and the state, I should say, that depends on it, it's going to be a problem for them.
Brian, I'm sorry, but I drug you into the audio discussion. But you said you were trying to look and see where the funding for your library came from.
Yeah, I was searching all over their website, looking at even like going to their governing board meetings and scouring through the minutes and just trying to see, learning about their funding, basically. I got some pretty generic responses about, I know a lot of it, our particular library system funds through the county. And so the county has its tax collection. And so I think that's the primary way that they get their funding. I was just curious how much that specific library would be impacted, because the article I mentioned a percentage that was impacted, but it didn't. I wasn't sure how impacted specifically my library system would have been, but it's interesting.
Yeah. Let's see. Brad in the chat room says, "I wonder how this will affect one of your faves, the Take Control ebooks." And I don't know. I know that I'd have to talk to Joe Kissel and as far as what his policy is regarding libraries. I mean, they are priced so much cheaper than pretty much any other group of books that you're ever going to see. But that book, it's still money, and the libraries still have to figure out a way to do it. So I'm not sure exactly how Joe would do it, but it's an interesting question. Next time I talk to him, I'll ask him and hopefully report back. Visit MacVoices.com for show notes and to connect with Chuck on social media. Get involved in our Facebook group or like our Facebook page, and get more out of your Apple tech with MacVoices Magazine, free on Flipboard and on the web. And if you find value in it all, consider supporting us through either our Patreon campaign at patreon.com/MacVoices, or by making a one-time donation via the PayPal link on our front page and in the show notes of each episode. You will join these fine people who help bring you Mac Voices. Advertising handled by Backbeat Media at backbeatmedia.com. Bandwidth provided by CacheFly at cachefly.com.